What makes BBL procedure, buttock augmentation with fat transfer, one of the most dangerous cosmetic surgeries? And are there any ways to make this procedure safer? In this video, we're going to talk about that. My name is Dr. Alexey Markelov. I'm a double board certified plastic surgeon. So let's talk about buttock augmentation with fat transfer, BBL. This is the procedure where the fat from one part of the body, usually from your lower back, stomach area, flanks and waist area, is harvested and then transferred into the buttocks to change the shape of your buttocks, to provide the buttock augmentation, fuller, curvier look. The procedure became very popular, and the reason for the name Brazilian butt lift procedure is because the procedure is frequently credited to the Brazilian plastic surgeon Yves Pitanguier, who first described the procedure in the 60s and 70s. This remains an area of controversy, and some people credit the procedure to different surgeons, but here we are calling this procedure Brazilian butt lift. Although from talking to my Brazilian colleagues, they don't do as much of those procedures as frequently the surgeons do here in Florida. So why this procedure is so dangerous? Well, there are a lot of death and bad outcomes reported to the Brazilian butt lift procedure. In South Florida alone, between 2010 and 2022, there were reported 25 deaths from this procedure. Based on the literature, the reported rates, mortality rates, or death rates when people actually die from the procedure, between 1 in 3,000 to 1 in 6,000, depending on who you read. So that's a very high rate. Just for a comparison, death from a breast augmentation occurs as rarely as 1 in 72,000 cases. So this is extremely high rate, again, by far exceeding all other cosmetic surgeries. It became such a problem that the state of Florida actually had to issue emergency ruling that will limit the number of procedures that can be done in a day by a single surgeon to 3 BBL procedures in a day, and they have to be performed now in the state of Florida with the ultrasound guidance. So why such a bad outcomes? Why people die from BBL procedure? Well, autopsy results and the study results found that the death frequently occurs from the phenomenon called fat embolism. So what that is, basically when you have the fat travel into your large vessels, blood vessels, your bloodstream, and that those fat particles, they clog your bloodstream, frequently result in respiratory compromise and breathing issues, and frequently causing death. So fat embolism is the main reason for such a high mortality after Brazilian butt lift procedures. How this can be mitigated, and what are the ways to avoid prevent high rates of fat embolism? The American Society of Plastic Surgeons actually created a task force where people who do a lot of those procedures looked at how to make this procedure safer and to avoid any major complications. So a few factors were considered, and this is what was recommended. The patient has to be positioned on the table in a certain way so the muscles kind of go away from the subcutaneous fat that's frequently injected during the buttock augmentation procedure. So the fat is being injected with the hollow metal tube called cannula into the gluteal region, and the common mistake is to inject the fat into the muscle or under the muscle, because you have the glutes, the buttock muscles, and if you inject the fat into the muscle or under the muscle, that's when the troubles happen. That fat can migrate into large iliac vessels, so blood vessels in your buttocks, and subsequently cause fat embolism. So we're gonna visualize directly where the fat is going. So we are not going too deep. We are not going into the muscle or under the muscle, because that's where the vessels are located. But we are not going too superficial. We are not close to the skin, because there are 2 layers. One very superficial layer under the what's called scarpus fascia, above the scarpus fascia. So that layer is very tight. So if you just inject in there, you're limited in the amount of fat you can put in and the volume, and it creates the flat, pancakey looking buttock. So we want to stay the layer below that, under the scarpus fascia, where that loose fat is, to inflate it, to create that nice round buttock appearance. But at the same time, we don't want to go too deep under the muscle where the vessels are, where the danger zone is. They also recommend to use a little bit larger bore cannula. That straw has to be a little bit thicker because it's harder to penetrate the vasculature with a thicker cannula. So certain position on the table, thicker cannula. Also, the recommendation is to use an ultrasound, so you can visualize directly with the ultrasound guidance where the fat is going. The problem is that frequently we as a plastic surgeons not trained to use an ultrasound, so people frequently have to go and learn all over again how to perform this procedure with the ultrasound guidance. So we have a good amount of fat. This was a skinny BBL. The patient is very skinny, but we got great amount. I also add a little bit of antibiotic to our fat, again, just for safety reasons. So we have 1.5 liters of pure fat. That's quite a bit. Probably she doesn't need that much, but we'll see. She was looking just for some improvement when she wears jeans, to look perkier, to look fuller. The patient is awake also. So we're doing this BBL awake. So she's talking to us, she's interacting with us, and also that adds extra layer of safety, because if you inject the fat into the muscle, she will feel it. If you poke her with this blunt cannula into her gluteus muscles, she will feel it. Usually people kind of squeeze their glutes to contract, and they can feel it. So that, again, that's an extra layer of safety to prevent accidental fat injection too deep. So here's the 2 layers. I'll show it on the screen. So I'll show it right there. So superficial layer, and this is that scarpous fascia, that connective tissue layer under the skin I was talking about. So this is where we want to be, in the deep fat, and below that is the muscle. So in conclusion, I think buttock augmentation with fat transfer can be done safely, especially if it's done awake, with the patient being awake. I think it's a great procedure for someone looking to improve their curves, to augment their buttocks in a natural way without the use of the silicone implants. Well, I hope you enjoyed the video. Click the like button, subscribe below, and see you soon.